Deuxième partie, pratique clinique.
Second section, clinical practice.
Alors, dans une relation professionnelle, évidemment, avant qu'elle s'établisse,
Before any relationship is established, the patient calls your office. We suggest that you have a professional welcoming message. Don't let your kids do the work and name all the members in your family. This is not a professional way of doing things. Identify yourself with your name, acupuncturist, so that the patient is not wondering where he or she is calling. And the same thing goes when the Orders Professional Inspection Committee is calling. Of course, if you are on vacation, you have to mention it. When we talk about a contract between the health professional and the patient, it is not a written contract, although it is considered as such and does really exist. And we consider that the first phone call is a pre-contract, engaging the patient and the acupuncturist. So once the patient comes to your office and accepts to have a treatment, this is in fact a contract. And this contract implies obligations for both parties. The first obligation of the patient is to be present at the appointment, but in certain cases, the patient doesn't show up or cancels the appointment. Therefore, you can charge administrative fees for cancellation. As long as this policy is posted in your waiting room and a note shall be written in the patient's chart. But consider that the amount you're charging for the cancellation fees should be relative to the amount you considered you've lost. To charge the full amount of the treatment can be contested because you did not use needles or bed sheets or anything like that. So now we're talking about the content of your diary, the daily schedule, including family name and first name of your patient. And also you have the obligation to keep these records for a full year. If December 26th is your last day of work, you must keep your records up to the previous December 26th. Now for advertising. We have seen so many unusual things. Maybe you saw a few of those examples yesterday. You probably know that the official acronym is written with a capital A and a lowercase c. We sometimes see capital A and capital C and any other acronym that is not standard, like DAC, DMTC, DTCM, MOAQ, doctor or specialist. And we often see those titles and acronyms that are not conform with the standard. Here we see the logo of the Order of Acupuncturists, AC, Order of Acupuncturists. And the way this is mentioned, it looks like you are working for the Order of Acupuncturists. That is what is written on my own business card. But if a regular member wants to make advertising on a business card, it has to be mentioned member of the Order of Acupuncturists. Of course, if you are doing any kind of advertising, you have to be careful when making statements to make sure that it fits with the fundamental theories of the order. If you're practicing any other trade or profession, If you are a member of another professional order like physiotherapist or nurse, you can use these titles as long as this profession is recognized by the professional board. If you own any diploma as determined or recognized by a Quebec law, especially the act respecting educational institutions at the university level, or authorized in a similar way by any other governmental authority, the professional is allowed to indicate and add those titles or their acronyms to their professional title or acronym. So this includes bachelor's or master degrees and so on. You can indicate them on your business card or any other ad you're doing. But as long as your title is in conformity with a recognized university degree in the province of Quebec, it has to be done according to the law.
Pour poursuivre sur la publicité, donc relativement à l'offre de service en tant qu'acupuncteur, si vous annoncez des services,
now, we carry on with the advertising concerning your services as acupuncturist. If you publish your services under your name or any commercial name, like Natural Health Clinic, you shall mention acupuncture in the first place, and then mention other therapeutic methods, not a title. For example, you can write Chinese herbal therapy. You cannot use the title herbalist. Or you can write Tuina massage, not massage therapist. But according to certain provisions in the professional code, you must be able to prove that you are competent in this other scope of practice. Let's say that you are a massage therapist, and that you know you can indicate Tuina massage on your business card or advertising. If you really are doing Tuina massage, you have to prove to us your qualifications and have the appropriate certificate. Otherwise, you cannot mention it. We cannot choose those words just to try to fit with the regulation. You have to be true with your statements. Now, concerning the receipts for acupuncture fees, this receipt must indicate the name of the recipient, also your name and your license number that can be read easily by any employee of an insurance company in order to facilitate the payment to the patient. If those informations are not indicated in an orderly fashion, it can delay the reimbursement to the patient, and maybe the patient would not be able to carry on with the treatments for lack of funds. So make sure that your receipts are easy to read and contain all the necessary information. Now, concerning convenience receipts, the answer is no. The receipt is for the patient. You cannot indicate any other name on the receipt, like the spouse name. And you can read more on this subject the orders newsletter issued in 2011. Now we're talking about the Workers' Compensation Board patients. You cannot charge anything to the patient, and this is written in the Workers' Compensation and Professional Diseases Act. You have to fill in a form and send it to the Workers' Compensation Board directly. It's still $27. This has never changed for the last 25 years at least. You are not allowed to charge the difference with the regular price of a treatment. Now, for the Quebec Automobile Insurance Society, the situation is different. It is an insurance. So, it's like any other kind of private insurance you can have. You can charge the full amount for a regular treatment. Let's say your fees are $60, and the patient will contact the Automobile Insurance Society, SAAQ in French, to be partially reimbursed up to $26 per treatment. Or there's another way of doing things, is that you will charge the difference to your patient, and you, as a acupuncturist, you will send an invoice to the Quebec Automobile Insurance Society for the amount of $26 per treatment. Of course, on the receipt, you only write the amount the patient gave you. You have those two choices for dealing with the Quebec Automobile Insurance Society. In your office, in your waiting room, usually you have a waiting room, and there are two documents that you must have. The first document is the deontological code, and the second is the regulation respecting the conciliation and arbitration of accounts. On each of those documents, you must indicate the address of the order. You must also show the annual certificate of your registration to the roll of the order. Because the acupuncture permit you're licensed to practice is issued only once, you have to show that you paid your annual subscription. And this shows that you paid your subscription before April the 1st of each year. But don't worry, if you don't receive your annual certificate by April 1st, there are some delays because of the fact we are very few employees in the order. Also, in your waiting room, you have the obligation to make available to your patients examination masks and rubbing alcohol-based disinfectant. In an acupuncture clinic, also, a sink must be easily accessible. Let's say that your office is on the second floor of a building and that the bathrooms and sinks are on the first or third floor. It's not considered accessible, which means that this location is not suitable for an acupuncture clinic. Concerning the treatment rooms, you have to ensure the intimacy and confidentiality, the appropriate furniture. Intimacy means that other patients in the waiting room or other treatment rooms do not hear or see what's happening in your treatment room. Concerning hygiene and cleanliness, you know that we will inspect your tables during an inspection. And if you take a look in the infection control guidelines document, you will see that the table must be covered with a non-porous vinyl fabric. And the reason behind this is to ensure that the treatment table is not covered by any other fabric like cotton or else. The treatment table has to be covered with vinyl or leatherette. It has to be non-porous and easily washable. Think of when you go to the dentist or the physician. Is there any other kind of furniture or any other kind of fabric or overlay on the examination tables? The answer is no. It's always leatherette, it's washable, you eliminate spreading of infections. If you use a cotton sheet and you want to cover it with a paper sheet, this sheet must have the full length and width of the table. Otherwise, you will have to remove and wash the fabric sheet after every patient. Even though we've seen that. Even though you put the paper sheet diagonally, you see you have the sheet like this. The patient will lie down this way, but the patient has to step on the table and the patient can touch the cotton sheet. You got it? Let's say that you have a cotton sheet and the paper is not wide enough to cover the whole table. We see acupuncturists place another length of paper shoulder height, and it's not accepted. because the patient will be in contact with the fabric, and you'll have to remove and wash the cotton sheet. If you have a paper sheet that covers all the surface of the table, it is okay. After every patient, you must clean all working surfaces and objects. Treatment tables, the small stool, the sink, with an appropriate germicide solution, like dilution of 10:1 of bleach, or a 5% hydrogen peroxide wipes. The brand like Excel TB, for example. And also make sure that you read the directions on the label to make sure. So, like we said, the surface of the table must be made of a smooth, non-porous fabric like vinyl or leatherette, covered with a paper sheet or examination paper roll that you change every time, of course. I have to remind you that if the cotton sheet is not entirely covered with the paper, you'll have to remove and wash the sheet after every use. Also, the towels or any other fabric that was in contact with the patient must be washed after each patient. Remember that if you use a blanket to keep your patient warm, it must be washed after every use. If you say, oh, I cover my patient with a paper sheet and then I put the blanket on top. But let's say if the patient is reaching out to scratch his nose, there can be a contact with the blanket. Imagine yourself as a patient. Would you like to know that another patient had been in bearskin contact with the towel? So, personally, I would not like that. So, if it potentially got in contact with the patient, you must wash the blanket. And by the way, we will see later that heavy blankets are not a good idea. So for washing your sheets and towels, we suggest that you have a concentration of 2 milliliters of bleach for every liter of water. Concerning intimacy, at all times you have to ensure the intimacy before, during, and after the patient is on the table. Have the appropriate means to cover your patient and respect hygiene considerations for linen. You know that we have patients that are more modest than others, and some of them will just disrobe easily and get on the table and tell you that it's no problem for them, you know. I'm not shy about it. I don't need to be covered, but you as a professional must be the one to be embarrassed. You must offer and insist that the patient be covered adequately. Let's say for women, cover the bra, hide and cover the bra and panties. Even though the lady tells you that they're not shy about it. We had members who have been found guilty by the disciplinary committee on this matter for not offering the proper linen to do so and cover themselves. It is important to have towels to cover your patients. Now, concerning sepsis, before inserting needles, do not take the needles out of the packaging. We've seen acupuncturists who were trying to save time before the patient was on the table, would unwrap the needles. And this is not allowed. You have to open the packaging as of the start of the treatment. You cannot open the packaging and put the needles in a metal recipient or tray. Even if you clean the tray with rubbing alcohol, which is not an appropriate mean of material disinfection, or if you put your needles in a cotton ball, even though you soak it with alcohol before use. The needle is out of the packaging and immediately inserted. Of course, you have to disinfect the skin before insertion with a 70% rubbing alcohol. Make sure that you read the label to be informed of the expiry date. You cannot dispose of the large bottle of alcohol when it's empty. If you buy a large bottle and transfer the alcohol in smaller containers, you must have a record of the expiry date of this big bottle, because the inspection committee can ask for this. And if you don't have this information, you can be in derogation of good practice. And beware of the concentration of alcohol, because we've seen in some dollar stores 50% alcohol, and you must use 70% at least or more. If you buy an alcohol bottle that does not have an expiry date, it is a bad choice, and return it to the store. You must know the expiry date. This is one of our obligations. After needle insertion, of course, do not reuse the needles. Disposable needles are made for single use only. Even if it's for the same patient, we must not reuse the needles. And we must have a biohazard container in every treatment room. Some people would say, oh, I put the needles in a small container that I clean. I then exit the treatment room and dispose of them in the biohazard container. No, the rule is one sharp container in every treatment room. This way, we prevent any mishap. So, you also have to check the expiry date on the needle container. Do not use expired containers in which you store new needles. But on this container, the expiry date is way out. So we can tell if those needles, even new, are okay, and that the sterilization method is appropriate. Neither. Concerning the electrical device or stimulators, you must have those devices inspected by a technician regularly. And what does regularly mean? It depends on the number of patients that you have. If you use a stimulator not so often, it doesn't really wear out too fast. Just try to use common sense. But the average for a regular use of electrical devices, we suggest an inspection by a technician every 2 years. This is considered average. Concerning lasers, the laser has to be calibrated. If you do not know the exact output, you cannot make the calculation for the amount of time required for precise stimulation of the acupuncture point. There is a conversion charter for every model of laser on the duration of point stimulation that is inserted in the record-keeping information binder. Now, for the heat lamps, halogen lamps are totally forbidden because they're dangerous. For the TDP electromagnetic lamp, you know that this device is becoming more popular among acupuncturists, and you must be careful with patients who have AIMDs, active implantable medical devices and systems. This does not only include pacemakers. It includes any kind of medical device that relies on an energy source like electricity or any other energy source that is not generated by the human body or by the weight. And those guidelines come from Health Canada. Consequently, if you are using a TDP electromagnetic lamp, your interrogation form with a new patient that the new patient fills in must ask if the patient is carrying an AIMDS. The butane torch for lighting moxas is totally forbidden anytime, anywhere since the adoption of a resolution by the Board of Directors in December 2014. Now, let's talk about the disinfection of semi-critical reusable instruments. Things like vacuum cups or any other instrument that does not include needle. There's a general disinfection procedure, which means that the patient must not ever been tested positive for tuberculosis. You must ask in your interrogation form, the questionnaire that the patient fills in. So here, with that kind of procedure, the disinfection of semi-critical reusable instruments, there's a whole procedure to be followed. First of all, soaking in soap and water. Second, rinsing with water. Third, followed by a complete immersion in a solution of 1 part bleach and 10 parts waters for 2 hours. That's it. And then the material is again rinsed with water and dried with a clean cloth. Finally, you store and cover the instruments with a clean cloth. For acupuncture heads and lasers, read the owner's manual. If you buy a laser from a colleague, let's say, make sure that you have the owner's manual. It is important for you to know about the laser's features so you can use your laser adequately. If somebody is asking you what kind of laser you're using and you don't know, you cannot make us believe that you're using it correctly with your patients. Let's say you have a Gerlaze laser 10 milliwatt diode, and you proceed as if you have a big $15,000 laser and you stimulate the point only for 2 seconds. It is not enough. Make sure that you know the features of your device. And remember that you must be competent in your practice. Now, we're talking about high-level disinfection procedures of semi-critical reusable material for TB carriers or vegetative bacteria or mycobacteria, fungi, and viruses. You must proceed immediately after usage with soaking in water and soap, rinse with tap water or distilled water, dry the instrument with a dry clean cloth, make a visual inspection, and proceed with a chemical disinfection. You have to follow the directions on the label depending on the brand you are using. The required amount of liquid, the duration of soaking, storage of the disinfection, and so on. There is a mandatory control of the concentration level of the product upon first use. Final rinsing, which is 3 times with distilled water according to the guidelines of Health Canada, 1 minute each time in this step. And then you have to keep a record of the dates of the disinfection procedure and also the dates that you have changed the disinfectant. For storage of these, you must store them in a clean area with no wind or draft, like a closet or a sealed container. You can find those details in the Infection Prevention Reference Guide. For the available chemicals, there are two options. There's the Sidex OPA. Of course, you have to verify the expiry date, or the other one called BM28, the latter being a 2% solution of glutaraldehyde, and there is an expiration date on those bottles. But for the disposal of the BM28, you must call a company specialized in hazardous material management. This company will give you a voucher. The other disinfectant, the Sidex OPA, can be disposed of in the sink normally. But BM28 is controlled by more restrictive regulations concerning disposal. If you take a look in the Infection Prevention Guide, you'll see that in both cases it is suggested to use an extraction hood in order to avoid inhaling toxic fumes. For the sharp containers collection vouchers, there are three kinds of vouchers that are accepted. The vouchers that you get from a specialized company, there is only one in Quebec, and the name of that company is Stericycle. This company will send you a contract, and they collect biohazard and sharp containers from dentists, veterinarians, medical clinics, all over the province of Quebec. And also you have vouchers from a certified collection facility with a permit, like a hospital or a local community service center. You have to make the appropriate actions to make sure that the hospital or local community center service gives you a voucher. The voucher is compulsory. Also, we accept vouchers from doctor's office. If there's one container for the doctor, one container for the acupuncturist, one for the dentist, everybody use the same containers if they use the same treatment rooms. You can add your sharp containers to their collection box, as long as the person responsible for the biohazard containers management gives you a letter or voucher. There are some informations that need to be indicated on the vouchers. We are not against the fact that a member brings their shop container to a pharmacist. Many members do that. But you need the voucher, any kind of receipt or voucher. It is your responsibility, and you cannot transfer it to another person. You must make sure that your containers reach the right destination. And you know that this is not regulated by the order. This is a federal law that regulates the disposal of biohazard material. This slide shows an example of a voucher from a local community service center that an acupuncturist received. This voucher includes information such as your name, your address. We know where this voucher comes from, a provincially recognized facility. What kind of biohazard material? In this case, it's acupuncture needles. The weight of the container, the quantity of containers, because sometimes
identifié. On doit aussi savoir que ce sont
The
des
pharmacist does not indicate that.
anatomiques ou des objets piquants. On parle d'aiguilles ici. La pesanteur et le nombre de contenants. Ce qui manque souvent, c'est
Sometimes,
le nombre de
like we said, when
contenants.
you bring your containers to the pharmacist, they don't indicate the number of containers that you have.
Le nombre de contenants qui est apporté qui ne figure pas.
And
je veux toujours
you
consulter le
can
guide de prévention
read
des infections.
anytime
Utiliser
the
l'information
infection prevention
nécessaire.
guide for more information on this subject.
Bon, le lavage des mains maintenant. Il faut savoir, il faut toujours se souvenir de ça.
Concerning
En matière de
hand
prévention
cleanliness,
des infections, le lavage des mains
always
considéré
remember
une
that
mesure la
the
plus
prevention
sécuritaire et
for the
la plus
prevention of
propre.
infections, washing your hands is the most effective and efficient there is.
Quelques savons qui sont acceptés.
There are
On
a few
parle de
kinds
savons
of soaps that are
antiseptiques.
accepted.
C'est un savon qui est à
You
base de
need
chlorhexidine
an
à 2 ou 4
antiseptic hand
On
soap
doit
containing 2 or 4% of chlorhexidine, washing your hands for at least 15 seconds. Also on the bottle there is an expiry date. So do not try to find an expiry date on a bottle of antibacterial soap. This is different. There is none. If you use an antiseptic soap, you are not needed to use the alcohol-based soap as often. So you can choose a 62% rubbing alcohol-based hand soap, washing for 15 seconds, and remember again to check the expiry date. If you use only an alcohol-based hand soap, you must also wash your hands with an antiseptic hand soap in order to remove the film that forms on your hands. At least every 10 hand washes that you do with the alcohol-based soap. And also for drying your hands, you must use paper towel or forced hot air. You cannot use a regular cloth towel. The decision that you make for having your patients lie down on the needles must be justified by a particular clinical situation or treatment orientation. If you put needles on the back and some needles in front, you must proceed in a safe manner. And the same goes if you cover your patient with a blanket during the treatment. It can be an increasing risk factor of infection. We see that sometimes. Risks are higher, and make sure that the needles on the limbs and trunk do not go deeper. The justifications to do so must be documented in the patient's chart. Now we're talking about any other location you practice acupuncture, like house calls or any other location like a hospital. When you go out of your office, the same requirements apply as if you were in your clinic. You need to carry your annual subscription certificate. Unless you bring, the whole frame from your office with you. You can order a duplicate of this certificate at the head office of the order, and there's a charge for that. You must also bring with you the Code of Ethics and the regulations on account, conciliation, and arbitration. Also, you must have with you the accidental percutaneous exposure kit with you. So if a patient is punctured with a needle, unwillingly, you must have the percutaneous exposure kit. Concerning intimacy, let's say if you do house calls, it is sometimes, more casual. Family members are there and so on. But the patient, in a professional relationship, so there is only two persons that are involved. You must ensure the intimacy of your patient before, during, and after the treatment. Have the necessary means for covering your patient, like towels. Have also basic hygiene means for linen. Sometimes you go to a place that is not necessarily as clean as your office. So you can bring your own clean bed sheets and towels with you. For confidentiality now, even though the patient's house is a place for sharing, with family and all that, the professional has the duty of respecting the secret of all confidential information is being told. Do not allow any other person, even family members, to be present during the interrogation, in the kitchen or with the children or the spouse. It is a private relationship. The same considerations apply in your office, even though you're doing house calls. When the patient enters your office for interrogation and to fill in the form, it only involves you and your patient. It is not appropriate to have the spouse or the patient's sister or whatever to be present. They have to stay in the waiting room. For semi-critical instruments, we're still talking about house calls here, or any other location. At all times, you must keep the same procedures for general disinfection. But there are certain considerations you must ensure for transportation of the material, so that there is no contact between sterile or disinfected instruments and contaminated ones. Concerning hands washing, if you do not have antiseptic soap, the patient does not have that at home. Ideally, make sure that you bring an alcohol-based soap with you during house calls. You will avoid any problems, and you'll be sure that your hands are clean according to hygiene rules. And for drying your hands, the patient probably does not have paper towels, and ordinary linen towels are not recommended. In the patient's bathroom, the towel was probably used by other people. So, in this case, alcohol-based soap is your best option. For management of the disposable needles, if you do house calls on a regular basis, you need the appropriate container, a small one that you can carry. But once you're back at your office, you cannot open this small container and transfer the needles in a bigger one. This is not allowed. Never. The handling of the contaminated needles must be done safely during transport. And this container, once you're in your office, shall be kept in a non-accessible and secure place. Do not put the sharp container on a shelf in your home or garage when your kids are playing around and have friends. Those friends can be a little snoopy, so the container has to be kept in a safe place.
Pour la trousse d'accompagnement, ce qu'on vous suggère, en fait, c'est de vous déplacer avec
If you practice outside of your office, we suggest that you carry an accompanying kit, including the following: the documents we talked about earlier, the proper linen, bed sheets, the patient's chart, alcohol-based soap, alcohol swabs for skin disinfection before needling, all single-use material or reusable instruments, the appropriate sharp container, and the accidental percutaneous exposure kit.